Spastic diplegia is a form of cerebral palsy where it's a chronic neuromuscular condition with hypertonia or spasticity. This means that they have especially high tightness in the muscles of the lower extremity, including the legs, hips, and pelvis. Spastic diplegia is caused by damage in the brain that inhibits development of the upper motor neuron function. So this impacts the motor cortex, the basal ganglia, and the cortical spinal tract. Nerve receptors in the spine that lead to muscles unable to absorb the GABA, so this means that they cannot regulate their muscle tone. Without the GABA absorption, nerves constantly fire to muscles, causing permanent contraction, and the muscles become hypertonic or spastic.
Patients with spastic diplegia have involvement on both sides, with spasticity in lower extremities worse than upper extremities. The patient will ambulate with an abnormally narrow base, dragging both legs and scraping the toes. There is also characteristic extreme tightness of hip adductors, which causes legs to cross the midline, which is referred to as the scissor gait. Patients will present with increased knee flexion at initial contact and during the stance phase. They will have reduced peak knee flexion and swing, increased plantar flexion in their terminal stance, increased plantar flexion in their loading response, and will have decreased movement in the terminal stance that is associated with a reduced forefoot rocker.